So the past 12 months have been incredibly difficult for the Health Board. We've seen the COVID-19 pandemic dominate everything we do as a health service, and our staff and communities have been challenged in ways we could never have imagined. The loss caused by the virus has been tragic, and the impact of the virus on our communities and staff will last for some time yet to come. The past 12 months have also shown just how committed everyone who works for the Health Board are to their work, and the level of resilience and support seen across Cwmtaf Morgannwg has been nothing less than inspiring. So it's important that as well as the significant loss we have experienced, we also recognise the achievements which have been made in the past year and which give us hope for the future. As our thoughts turn to how we restart services and recover from COVID-19, building strong relationships between secondary and primary care, we are committed to ensuring that the learning and successes are used to shape how we work in the future, how we go about addressing the challenges we face, and our improvement journey as part of our targeted intervention and special measures escalation status. We will also be using our learning from the pandemic as a spur to tackle head-on the persisting health inequalities of our communities. As a board, we remain committed to ensuring that people, quality and safety are at the heart of everything we do. This video is just a snapshot of our journey over the past year, the dedication shown across CTM, the benefits of partnership working, and the improvements and learning across our Health Board. Cwmtaf Morgannwg University Health Board is responsible for the healthcare of around 450,000 residents across communities in Bridgend, Rhondda Cynon Taf and Merthyr Tydfil. We employ more than 12,500 people and deliver care across 3 district general hospitals, 6 community hospitals, 1 mental health site, 29 health centres and support facilities, 51 GP practices and many other community services. Last year saw more than 145,000 A&E attendances, and we have conducted hundreds of face-to-face or virtual consultations. We've worked hard to raise our profile in the past year and now have a social media following of more than 33,000 on our main Facebook page, 16,600 on Twitter and 3,700 on Instagram. We're pleased to say that we continue to meet and exceed our target to reduce carbon emissions by 3% each year. The COVID-19 pandemic has hit our communities and staff extremely hard, and sadly, many loved ones have been lost to COVID-19. The past 12 months have seen our staff rise to the challenge of the pandemic, including a devastating second wave in late 2020. In the most inspiring way, teams have worked together to support each other, and many staff were redeployed to new areas of working. We created new ITUs, wards, departments, and even a whole new field hospital, Ysbyty y Seren in Bridgend. We also have been working hard to try to keep many services going. And teams have had to adapt to new ways of working, to wearing PPE and to using new technologies. The rapid rise in numbers in our communities during the second wave was felt across our sites as cases peaked, and our teams had to work hard to adapt and respond to the challenges of COVID-19 outbreaks within some of our hospital sites. As we begin to look at how we live alongside COVID-19 and recover from the impact of the first 2 waves, we will ensure that the achievements, learning and joint working with our partners will be captured, so we can build on these opportunities as well as support each other as we try to heal together as a community which has lost so much as a result of this devastating virus. We have always valued working with our partners, and the past 12 months have seen those relationships go from strength to strength, coming together to respond to the COVID-19 pandemic. Some examples include Working with our local authority partners and Public Health Wales to deliver an effective Test, Trace, Protect programme to reduce the spread of the virus. Developing support for our communities, including information sharing and the creation of a self-isolation helpline. Partnership working with primary care, local authorities and Welsh Government and our amazing team of volunteers for the successful rollout of the COVID-19 vaccines. Working with local authorities, the military, Public Health, South Wales Police and Welsh Government to set up Wales's first mass testing pilot in Merthyr Tydfil and the Cynon Valley. Working with the University of South Wales on research and innovation and receiving support from students to help respond to the pandemic. Working closely with our primary care colleagues via our clusters to provide care and support to our communities throughout the pandemic, and while much secondary care had to be stood down. Looking ahead, we will be working with partners, in particular the Regional Partnership Board and the Public Services Board, to support the delivery of newly established intelligence cell to review the impact of COVID-19 on our population and to inform future action to address the inequalities in health and the wider determinants of health and well-being. This includes how we can deliver preventative services to address lifestyle and risk factors. We continue to make steady progress in response to our escalation status of targeted intervention. We're focusing on 3 key areas for targeted intervention: trust and confidence, leadership and culture, and quality governance. Some key developments: the implementation of new ways of working and robust frameworks to improve our quality governance structures, and a new focus on how we involve and engage with staff, stakeholders and our communities to improve trust and confidence. We remain committed to doing everything we can to improve our work in these areas. The commitment extends to our maternity services at Royal Glamorgan and Prince Charles Hospitals, which were placed in special measures in April 2019. Despite the challenges of the pandemic, our maternity teams have continued to work hard to make improvements to our services during this past year, listening to women and families and learning from their experiences to make improvements and developing systems to better measure effective practice and rigorous incident reporting. We have worked hard to support women and families throughout the difficulties caused by the pandemic and taken innovative approaches in addressing anxieties, including the development of virtual tours for our units. It remains our goal to deliver a maternity service of which staff and the local communities can be justly proud. While we've been limited in being able to celebrate achievements this year, our staff recognition event at the end of December 2020 gave us an opportunity to thank everyone for their commitment and dedication and mark the event by providing all members of staff with a rainbow badge. The event was an important way for us to recognise what staff have been through and demonstrate the difference their efforts had made to fellow teammates as well as our communities at such a difficult time. To show our support, we also lit up a number of sites in rainbow colours throughout the evening. This was followed by another light up of our sites in March to acknowledge the anniversary of the first lockdown and to show solidarity with families and staff who had lost a loved one during the pandemic. We have also remained committed to innovation, with just a few of the examples being the ongoing development of Bridgend Health and Wellbeing Centre as part of Sunnyside Wellness Village in Bridgend, the refurbishment of Dewi Sant into a health park with work due to be completed late summer, the development of a new primary care centre in Mountain Ash, our clinicians and teams contributing and participating in COVID-19 research, making use of 3D technology to print materials to support our response to COVID, using new technology to deliver care, such as virtual appointments with clinicians. The development of virtual tours to help support patients to feel safe in the light of COVID-19. Virtual Q&As with our staff to listen to their views and ideas. Live streaming our board meetings as a commitment to transparency and openness in our decision making. This year, a key focus for our organisation has been the launch of our values and behaviours. Over the past 18 months, more than 6,500 pieces of feedback have been received from colleagues, patients and service users to find out what's important to us all. Working together and with the vital support of our trades union partners, we shaped our values, and in October, on World Values Day, we launched them across CTM during a special virtual event with staff. These have been particularly challenging times for our organisation and indeed across the whole of the NHS in Wales, and for us individually as we navigate our way through the COVID-19 pandemic. Our values are not intended to provide all the solutions, but together, working as one team, they are intended to help us focus on how we can be at our best. Since the launch, we've been working with our teams to promote and highlight how staff are living these values and behaviours and applying them to everyday situations. Looking ahead, we will be continuing our work with staff to truly embed these principles into everything we do and be an organisation that puts people and the values and behaviours we all live by at the heart of everything we do. Other key developments in supporting our staff have been a focus on wellbeing support for staff during the pandemic, the work of the Our Staff Networks and Our Arts and Wellbeing Steering Group, and the launch of our Leadership and Management Development Programme, all of which are helping to make CTM a supportive and inclusive place to work.
We hope this video has given you an understanding of some of the challenges we've faced as well as the achievements we've achieved at CTM this year. We remain really proud of our staff and committed to delivering the best service for our communities, and you can find more about our achievements in our annual report, which is available on our website. So looking forward to the coming year, we'll obviously be refocusing on recovery from the pandemic and restarting our services. We'll be looking to build strong relationships between our primary care and secondary care colleagues to make sure our communities receive the treatment as quickly and safely as possible. We'll think about how we can deliver care with a focus on delivering more care closer to people's own homes. And we'll learn from the pandemic and focus on tackling the real health inequalities in our population. As we develop our health strategy, we'll be looking at how we can support people to improve their health and well-being and deliver preventative services and upstream prevention to try and help people deal with the mental and physical effects of the pandemic. We want to carry on working and building relationships with our third sector partners, the staff, communities, and other people who've worked so closely with us during the pandemic, making sure that we're available to support our communities and finding the solutions to the challenges we all face. We'll obviously put our staff and patients at the heart of our services and work to do our best for them all. We really remain committed to improving our services and wanting to continue to listen to people's experiences and ensuring that those shape how we work as an organisation. And most importantly, we want to support the well-being of our staff to make CTM a great place to work and support and develop our leadership capabilities. We'd like to thank our staff, our communities and our partner organisations for all the help they've given us over the past 12 months, and we look forward to working with you in the future as we move into an exciting next phase for CTM. Thank you.